Good afternoon, everyone. So my study is to the effect of preservative-free Travoprost on proximal lacrimal drainage system using ASOCT. So topical anti-glaucoma medications are reported to induce inflammatory and fibrotic changes both in the conjunctival surface and epithelial and subepithelial tissue of the lacrimal drainage system. So patient on these medications may develop watery eye either due to ocular surface disease or due to lacrimal drainage system obstruction. In our study, we have studied the proximal lacrimal drainage system, which begins from the punctum, continues as the vertical and horizontal canaliculus, and then as the common canaliculus up to the internal common opening. The purpose was to study the effect of preservative-free Travoprost eye drops on proximal lacrimal drainage system in newly diagnosed glaucoma patients using ASOCT. So we considered three parameters: external punctal diameter, internal punctal diameter, and vertical canalicular depth. So all newly diagnosed patients on monotherapy were included, and this was a prospective study conducted for 1.5 years. My sample size was 30 eyes. Comparison was done by ANOVA and Bonferroni post hoc t-test, and p-value less than 0.05 was considered as significant. So all patients with normal punctal diameters were included in the study, and patients requiring any adjuvant treatment or lid disorders were excluded. So imaging was done using Topcon DRI OCT Triton Plus OCT with anterior segment module. Images were captured before starting on topical Travoprost therapy at 3 months, 6 months, 9 month and 12-month follow-up, and 3D anterior segment protocol was used. The lid was gently everted, exposing the punctum, and the horizontal line of the scan was placed parallel to the lid's mucocutaneous junction, and image was acquired. After acquiring the image, external punctal diameter was measured from the highest point on the nasal and temporal wall of the punctum. 100 micron below the external punctal diameter, the horizontal line measures the internal punctal diameter, and the vertical canalicular depth is from the perpendicular line from the external punctal diameter to the base of the punctum. So we saw that Travoprost caused a substantial meaningful reduction in IOP over the study period. The external punctal diameter showed a few fluctuations, but there was no significant change over 12-month period. The internal punctal diameter remained relatively stable for 1 year, and vertical canalicular depth also remained stable over the observation period. So lacrimal drainage system obstruction has been evaluated previously by lacrimal probing, syringing, UBM. UBM is still used, but it can give low resolution images. So anterior segment OCT is an upcoming imaging modality to study the lacrimal punctum. This obstruction can be caused by the medications themselves, the preservatives used, or because of the duration of treatment. So we have used preservative-free eye drops in our study, thus eliminating the role of any preservative, which can be a confounding factor. And we saw that Travoprost 0.004 eye drops do not cause any significant anatomical changes in the lacrimal punctum and canaliculus when used as a monotherapy for a duration of 12 months. Travoprost, known to cause ocular side effects like conjunctival hyperemia, watering, irritation, could be attributed to the inflammatory and fibrotic changes in the conjunctival surface. So Travoprost is an effective anti-glaucoma medication causing significant reduction in IOP when used as a monotherapy. ASOCT can be used to quantify and monitor the proximal lacrimal drainage system changes and can also be used for patient education. And Travoprost does not cause any significant anatomical change in the punctum and canaliculus as measured on ASOCT when used as a monotherapy for a period of 12 months. But the limitations were it was a small sample size, and since anti-glaucoma medications are used for a longer duration, we need long-term studies. But it was the first study, as per our knowledge, to evaluate the effect of Travoprost on proximal lacrimal drainage system using ASOCT. And since preservative-free eye drops were used, the side effects caused by the preservatives could be eliminated. So we would like to recommend that punctal scan by ASOCT can be done in patients started on anti-glaucoma medications who complain of watering. This can help us differentiate lacrimal drainage system obstruction from ocular surface changes as the cause of watering and thus provide appropriate treatment to the patient. Thank you.
What was the range of the puncta you found before you started Travoprost? Like before you're planning to start, was there a range or all the dimensions were equal?
There was a range which we had used a study. According to the study, the normal parameters were defined, and we had included all the patients who fit in those parameters. And then on follow-up, if the level is going, the value is going below the range, then it was considered as significant.
I'll ask a question. What was your control?
So this,
You have concluded that it's better, or it doesn't cause. What was your control? Against what?
we had
Against
not
what?
done a comparison study.
How can you say it's better?
It was compared over the time duration.
With what? Just a minute.
Like the same
So,
patient.
second, no, that's done. You have used.
Think about it.
Think about it. Next time you do it.
Yes.
You were manually pulling the lower punctum.
Yes. Sir.
That's a confounding factor. One day you're in a good mood, you'll pull it gently. You're not in a good mood, you'll pull it stronger. The punctum is going to open.
Let us not comment all that. You should have had a
Control.
comparative
What I'm
Yes,
saying.
sir.
control.
Thank you.
Yes, sir.
Thank you.